Hello, my name is Laura, and today we are going to discuss how to deal with imposter syndrome with hEDS. First, what is imposter syndrome? Imposter syndrome is the condition of feeling like a fraud in your own skin, feeling like you are deceiving yourself and those around you into believing you are something that you are not, despite the reality of your lived experiences and accomplishments. Imposter syndrome comes in many forms. It could be you getting into a really prestigious academic program and then feeling like a dummy surrounded by geniuses, as if maybe there was some mistake on your test scores or that you just got lucky getting in. It could be you accepting an award at work, but then feeling like you didn't accomplish enough to deserve it. In the chronic illness world, having imposter syndrome means that you sometimes doubt your own illness. On a good day, you might question if the symptoms you were experiencing the day before were really that bad after all. Did the doctors make a mistake and misdiagnose you with a condition because of some weird coincidence? You might even wonder if it truly is all in your head. Imposter syndrome can be very damaging to the psyche and rarely has a positive effect. Because the majority of my hEDS symptoms are on the mild side, I sometimes experience self-doubt about my own condition. So how do we deal with it? To help combat imposter syndrome, I have come up with 3 easy steps. Step number 1, ground yourself in reality. To ground myself in reality, I acknowledge the facts of my situation. I have been officially diagnosed with hEDS by a geneticist. That diagnosis was given to me after a very thorough 2-hour-long appointment where my entire body and medical history was meticulously examined. Some of my relevant symptoms of hEDS include joint hypermobility and instability, daily musculoskeletal pain, esophageal dysmotility, reflux, POTS-like symptoms, pelvic floor dysfunction, vocal cord dysfunction, Raynaud syndrome, and migraines and headaches. Those symptoms, however mild and insignificant on their own, are quite numerous for just one person to have, especially a young person. The fact is, all of those symptoms combined in a single person just screams connective tissue disorder, and I'm sure my geneticist was very aware of that. Even though I often feel pretty great most days, it doesn't negate those facts. By grounding myself in reality and sticking with the facts, I can push aside those doubts about my diagnosis. Step number 2. Stop comparing yourself to others. I'm part of several Facebook EDS support groups, and I use them mostly to receive and give advice and recommendations. I'll read other people's posts about their EDS experiences, and sometimes I just can't relate to them at all. For instance, posts about struggles with reacting to adhesive tapes, joints dislocating on a daily basis, or vomiting after every meal. If I compared myself to those people, I might not feel like I ever belonged in those support groups since I can't relate to their struggles. Comparing yourself to others in this way doesn't benefit you at all. While shared experiences can feel very validating, it's important to remember that everyone's experience living with hEDS is going to be different. Simply acknowledge those similarities and differences and move on. Step number 3, reframe your thoughts. If you're having doubts about your own condition, try to reframe those negative thoughts into something positive. For example, instead of thinking, "My symptoms are so mild, I couldn't possibly have a chronic illness," try changing that to, "It's fan-freaking-tastic that my EDS symptoms are so mild because it allows me to live the life that I want." A simple change in perspective can be a real mood booster. So to recap, the 3 steps to combat imposter syndrome are: ground yourself in reality, stop comparing yourself to others, and reframe your thoughts. Have you ever dealt with imposter syndrome? Let me know in the comment section. If you found this video helpful, please click on the like button and consider subscribing to my channel. You can subscribe by clicking on the round photo of me in a big floppy hat on this screen. If you click on the notification bell symbol, you will be notified when I release a new video. As always, thanks for watching and see you next time.